I'm Dr. Neil Hutcher, a bariatric surgeon by trade and a past president for the American Society of Metabolic and Bariatric Surgery and chief medical officer for SRC. SRC, which stands for Surgical Review Corporation, was founded in 2003 to address inconsistent outcomes, serious complications, and patient fatalities associated with bariatric surgery. We set up standards and requirements to protect patients. What started as one accreditation offering has now grown into a global patient safety nonprofit offering more than 30 accreditation programs for surgery, anesthesia, and endoscopy. It is my pleasure today to introduce Dr. Tamer Said Salama, an SRC Master Surgeon and Surgeon of Excellence with Saudi German Hospital in Dubai. The hospital and Dr. Tamer individually have achieved accreditation in multiple SRC programs, including bariatric and minimally invasive surgery. Dr. Tamer is a well-known leader in the field of bariatrics. He has more than 15 years experience and has performed more than 3,000 successful surgical procedures. He has published more than 50 peer-reviewed articles on bariatric surgery and is a well-regarded member of multiple surgical societies. Dr. Tamer has helped establish centers of excellence in different hospitals in the Middle East, and we are honored to receive his perspective on SRC accreditation process. Welcome, Dr. Tamer. We know you've been practicing bariatric surgery for many years, so we'd just like to know what were your motivations to seek recognition and accreditation with SRC?
First, I would like to thank you, Dr. Hutcher, for this wonderful introduction for me. Really, I'm proud, especially this nice word coming from a great surgeon, great bariatric surgeon like you. So thank you so much. Actually, when I start my private career, even before starting thinking or producing Center of Excellence, I always put my mind that my patients or our patients always deserve the best in everything, the best as regard the system, the best as regard the instrument, the best as regard the hospital equipment and service. So this was always an end point to me, to give my patient the best service I can do. So when the idea of Center of Excellence appeared in the beginning of 2010, almost, I was already doing this. I already was doing this process, but without a clear name or without a clear definition. So it was very simple, and the decision was very easy. Once in Center of Excellence or this organization appeared, it was very easy to take the decision and to apply in this system and to be involved in this system.
Well, we know surgeons are the central part of any type of a center of excellence for surgery, but surgeons can't work in a vacuum. They must have a multidisciplinary team. And it would be interesting to know how your multidisciplinary team viewed your decision to become a center of excellence, and whether or not the process of becoming that center brought your team closer together.
Actually, this is a very important question because, as you said, the Center of Excellence is not only built on a surgeon, it is a multidisciplinary team, or it's built on a team. We have two main issues: the working or the physician or the surgeon team, and the hospital itself, which is very important, which plays a very important role in this way. In multidisciplinary team, this means that we have a surgeon of excellence, or surgeon have a great expertise as regard the surgical technique, as regard the process of accreditation itself, and there should be a true vision from the organization itself or from the hospital itself to give the best health care for our patient. If this both pillars come together, at this moment we can do a good center of excellence.
Well, you know, we have an old saying that you must know what you don't know. What were some of the main things that you discovered in the preparation for this process, which requires extensive documentation and review of your own internal processes and procedures?
Sure, the documentation was one of the most important points which we struggled in the beginning of this, and when the idea of the Center of Excellence appeared as a whole. But nowadays, you know, documentation is a mandatory process. From this documentation, you can get data, you can get information about your result, you can get information about your technique, you can get information about very small thing. We can find we can get a lot of data from it. So documentation is a very important point. Sure.
Well, you know, SRC is significantly different from other programs which grant accreditation, as we view it as a continuing partnership between our centers as surgeons and SRC. And we offer designee services that include communication, marketing, outcomes analysis from the data that you submit. How do you plan to utilize these additional benefits?
Hey, let me tell you something. To be honest with you, this is not the first center of excellence who I'm working on, or this is not my only cooperation with SRC. But the most important benefit or the most important point SRC, their continuous support as regard support for the surgeon in the matter of continuous education for the surrounding team, for my nurses, for my disciplinary team, and for the continuous support as regard patient education, which is very important point. Continuous visit up and continuous follow up for our instrument, for the continuous inspection for the hospital. All of this point give like accreditation for the SRC accreditation itself. Give trustability and give benefits from this accreditation.
How do you feel that your accreditation will affect your patient acquisition and patient education?
Patient education starts from before the operation, not after the operation only. We start from the moment which the patient arrives at the hospital, from what he is going to do in discussing the same in details. What is the surgery? What is the possible complication? What we are using? What we don't want to use? If he is eligible for the surgery itself, all of this pathway, which is one of the points which SRC look for it and be sure that we offer our patient all of this information, is representing like a educational pathway for the patient from the start till the end. Post-operative follow-up, post-operative communication, post-operative continuous education for our patient. All of this point, SRC is continuously inspecting and follow at this point.
We know that Dubai is a center of medical tourism. Do you feel that the SRC seal recognizing your excellence will be of benefit for medical tourism and in promoting not only your personal program, but that of Saudi German Hospital?
Let me tell you a small history about how the progress start in Saudi German Hospital in Dubai. Actually, we are not like a regular hospital anymore. We become a medical city. Medical city, which means that a medical city based on multiple centers of excellence. You understand me? So this is represent the progress of center of excellence and its importance. So we believe that the importance to elaborate or to establish multiple center of excellence in multiple departments, which will improve our end result point and the patient safety by the end. So sure, it will improve our result as regard medical tourism, as you said. It will improve as our result in our patient safety as a whole. Yeah.
Just like we talked about the multidisciplinary team, a critical part of that multidisciplinary team is your administration of Saudi General. How have they viewed and supported your quest to deliver the most excellent of patient care and the processes required for its recognition?
To be honest with you, I have a full support from the administration in Saudi German hospital group as a whole. Let me tell you some information. First of all, we are one of the biggest healthcare organization in the Middle East, if we are not the biggest one. As I told you, we progressed from just a hospital to a medical city, which is built upon multiple center of excellence. The second point, they have a main concept on which they build on their healthcare service, which is we care as a family. So when I came and told them I need to do this center of excellence, it was very easy to convince them, and they told me, yeah, Dr. Tamer, do whatever you want. You understand me? So because this is their inner belief, we care as a family. So it was very, they were very supportive. They were very, they put the health of our patient or the safety of our patient as a priority. You understand me?
I understand you very well because I experienced it back in 2004 when we developed our first accreditation with SRC. It was instrumental, and we coined the term transformative process because the many members of my well-established team at the time really were functioning as individuals and didn't realize the importance of being an actual team. And the transformation in our bariatric program served as an example for the rest of our hospital. And the things we were doing, what we thought was in isolation for our bariatric patients, turned out to be the model that the remainder of the hospital adopted. It was an important part in them becoming what's a very honored thing called merit recognition for the nurses in the hospital. So there were a lot of secondary benefits. And do you anticipate that those benefits that you and your patients received from coming together for your accreditation will influence other surgical specialties within the Saudi German hospital to seek their own individual accreditations from the menu of 30 programs that we offer?
Let me tell you something. Well, first of all, we are planning now to do a committee for Center of Excellence accreditation, which is support my word about, we know here in Saudi German SCH in Dubai, we know the importance of this program and we know how it affects healthcare results. So we are undergoing to make a committee for accreditation in order to be sure that all of our departments is going to be accredited in different specialty, with different line of diseases. This is the first point. Second point, let me tell you something. Nowadays, the patient is intelligent. It's not like he know this. Yeah. He know this very well. He come and ask, Dr. Tamer, do you have a center of excellence here? Do you have a center of excellence for the bariatric? Do you have a center of excellence for minimal invasive? Or even on the opposite side, when we are a center of excellence, he tell me, yes, we know that the center of excellence means that you did a certain number of cases, that you are using a certain instrument, that you have a certain pathway. So the patient himself is become aware by this definition or by this pathway, which is going to affect his result by the end. So sure, we are working on this. Yeah, we are working on this.
Well, one of the things we took us a while to recognize, but has become a very important part of our message, is that many of our patients are more concerned about anesthesia than the actual surgical procedure. They say,
Yeah.
doctor, will I wake up?
Yeah.
So we recognized some years ago that there's a very powerful message when you include your anesthesia people in the Center of Excellence process. And we developed programs so that they could be recognized along with the outstanding work of the surgeon. So the patient has the added confidence that not only is his or her surgeon dedicated to my welfare, but so is the anesthesia department within the hospital. So we hope in the near future that we can recognize your anesthetists as well as the outstanding surgeons in your multiple specialties.
Actually, we are working in this point. This is one of the points we are working now for to be accredited with the anesthesia team, to be a center of excellence, especially that, as you know, as long as we did our required number of cases in the bariatric team, so we already did it in the with the anesthesia team.
Yeah,
this is,
absolutely. Yeah.
This is a fact. So we are working on this, and to be honest, when we have an inspection, site inspection or hospital inspection, there was a special interest from the team who come to visit us to get a full detail about our anesthesia team and how are they dedicated or professional in this type of surgery, because especially in the bariatric surgery, the anesthesia team plays a very, very important role, and they're expert to how to deal with obese patient or morbid obese patient. They have a very big role in this. Yeah.
Well, when you talked about the people from SRC coming to your facility for the in-person assessment, many people have experience with other accrediting agencies where they come with the purpose of trying to find out what's wrong with your program. We pride ourselves at SRC that our facility assessment is more of a consultative process where we come to find out what's right with your program, to learn from you as well as to inform you of the information that we've learned from the hundreds of hospitals we've visited and the thousands of surgeons we've talked with. Do you have any comments to put other surgeons and administrators at ease about what you experienced during your facility assessment?
Let me tell you something. This is one of the, I believe this is one of the strength points which I face or I go through with it with the SRC, that you are not coming to say or to get what is the issue or what is the problem. No, you are coming to support, and you are coming to be sure that we are giving our patient the maximum we can do, or the best we can do for them as regarded equipment, as regarded facility. So you are coming to support us and support the patient, which is very important point, as I said in the beginning. I believe that the SRC system as a whole, or the inspection as specifically, is coming. They are coming to see the hospital to continue what we fail to continue, or to see what we may not see before, or to give us a spotlight about this point, not to get a wrong or mistakes. No.
Well, it's been a pleasure talking with you this morning or this evening. And I look forward to a return trip to Dubai in the very near future so that we can be together more than electronically. So again, I thank you for recognizing SRC. And as I stated before, it's an honor to have you and the hospital system of Saudi German as members of our family of excellence. And I look forward to our continued partnership And I emphasize for those other people who might view this, that partnership, quality, value, and designee services are what I feel set SRC apart.
Sure, again, Dr. Hutcher, it was my pleasure for this long-term partnership since 2015 almost, going through the Master of Bariatric Surgery, Master of Minimal Invasive, then establishing more than Center of Excellence. And again, I should confirm that I believe that the Center of Excellence is not a program, it's not just a program for accreditation. It's a way of thinking for the sake of the patient, for the sake of the surgeon himself, for the sake of organization. I believe that the big hospital or the big organization or well-established organization is the only one who can think in this way, and the only one who is like or prefer to go through this pathway. Again, we are not just a hospital, we are a medical city which build on multiple center of excellence, aiming to give our patient the best result, the most safest result. And we hope that by our partnership, give the patient the best quality. Thank you so much. I appreciate it.
Absolutely. Again, thank you.